Hi there, my name is Megan. I'm going to be your nurse today for your physical assessment. Can you please tell me your name and date of birth?
Gabby Mesquita, 11/19/1998.
Okay, and right after I put on my gloves, I'm going to check that wristband and make sure it matches. Alright, thank you, Gabby. And do you know what today's date is?
April 5th, 2020.
And do you know where you are?
The Resurrection Medical Hospital.
And do you know what you're here for today?
A checkup.
Nice. And Gabby, can you just tell me what this is?
A pen.
And can you hold your arm out just simply like that? Great, Gabby. You're able to identify objects, follow instructions, and there seems to be no slur in your speech. Now, can you please smile pretty for me? Oh, thank you. There's no facial droop. Your face appears symmetric, and there's no involuntary movements. Now, Gabby, I'm going to assess your sense of touch. And now I'm just going to feel your cheek, and can you tell me if you feel me touching it?
Yeah, I do.
Okay. You feel on both sides?
Yeah.
Okay. And you feel me touching your arm?
On both sides.
Yep. Legs,
Both sides.
hands,
Both sides.
and feet.
Both sides.
Okay. And now, Gabby, I'm going to have you differentiate between a sharp or dull sensation.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
All right, thank you. And now, Gabby, I'm just going to take a look at your pupils. Okay, they appear round and equal in size, and they're about 3 millimeters. And then, Gabby, can you just look far in the distance and focus on that light switch? Okay, and then focus in on my finger. Good, both pupils constrict. And then keep focusing on my finger while I move it closer to your nose. Perfect, both eyes converge inwards. Okay, Gabby, I'm going to go ahead and turn off the light so I can test for your light reflex. And I'm going to have you stare into the distance and focus onto that light switch while I bring the light inwards.
Okay.
Maintain your focus. Good, both your eyes are reactive to light on both sides. And there's direct and indirect pupil constriction. Now, Gabby, have you been experiencing any chest pain? Good. Have you noticed any sores or lesions on your arms or legs?
No.
Any numbness or tingling?
No.
Any swelling?
No.
No? Okay. I'm just gonna make sure there's no edema down here. Alright. No edema present. I'm gonna go ahead and feel all your pulses now, Gabby. Okay. I'm gonna start with your carotid. And your brachial. Radial. Ulnar. Just move your legs outward for me. Popliteal. And your two pedal pulses down here. Dorsipatellar. Stereotibialis. Okay, thank you, Gabby. I'm just gonna have a listen to your apical pulse real quick. Okay. Okay, and then I'll just count your radial real quick. 30 seconds. Okay, good. The pulse is 80, the rhythm is regular, and the amplitude is +2, which is normal. Okay, Gabby, have you had any shortness of breath lately?
A little.
Have you had a cough with that?
Uh-huh.
And with that cough, do you sometimes produce any sputum?
Yeah.
Do you know what the color is?
It's whitish.
Whitish. Okay, now I'm just gonna have a listen to your lung sounds, if that's all right.
Yeah.
Okay, if you could just sit up straight for me and take deep, big breaths. Right, thank you, Gabby. The lungs are clear bilaterally, and your respiration rate is 18. You're not using any accessory muscles for your breathing, and the chest expansion is symmetrical, and there's no barrel chest. The color of your lips, face, and your chest match your ethnicity, so that shows that there's no sinus cyanosis. And I'm gonna check down here for your nail beds. Capillary refill is under 3 seconds. The nail beds appear pink and there's no clubbing. Experiencing any abdominal pain lately?
Yeah, a little.
Okay, have you had any nausea?
Mm-hmm.
Yeah? Any vomiting?
No.
No? Okay, good. Where is this pain?
Like right here, mid-stomach.
Mid-stomach? How would you describe it? How would you say it feels?
It's like sharp, but definitely bearable.
Okay, does it stay in that one spot or does it spread?
No, it stays in the one spot.
Does anything make it feel better?
Sprite?
Anything make it feel worse?
Not really, no.
Okay, and then if you were to rate the severity of this pain, 0 being no pain at all and 10 being the worst pain ever, how would you rate it?
6.
6. Okay, and last question, when did the pain start?
Yesterday morning.
Yesterday morning, okay. Okay, what was the last thing you ate or drank?
Peanut butter and jelly and milk right before I came here.
So this stomach pain hasn't affected your appetite at all?
No.
Okay. And what about your last bowel movement?
This morning.
Have you had any trouble passing? No?
No.
Okay, what color was the stool?
It was brown.
And was there any change in consistency for you?
No, it was normal.
Okay, good. Alright, Gabby, I'm just gonna have a listen to your bowel sounds if that's alright. I'm gonna lean you back. Okay, Gabby, sounds good. I heard bowel movements in all 4 quadrants. I'm just gonna lift your shirt up real quick. Okay, and are you okay with me palpating your abdomen real quick?
Mm-hmm.
Let me know if you feel any pain.
No. None so far.
No? Okay. The abdomen is soft and flat and is not tender. And Gabby, when was the last time you peed?
Before I came.
Good. What color was it?
Yellow.
Yellow. Was there any pain or difficulty during urination?
No.
No? And was there an odor to it?
Yeah, like a mild one.
Just a mild one. Okay. Well, usually dark yellow pee is a sign of dehydration, so I'd encourage you to drink more liquids.
Okay.
Okay. I'm going to go ahead and sit you up. And I'm going to assess your arms, so if you could just lift up your sleeves for me. Okay. Arm size appears within normal limits and they're equal, symmetrical bilaterally. The skin is appropriate for your ethnicity. There's no signs of edema in the arms or fingers. There's no clubbing or discoloration. The capillary refill is under 3 seconds. Skin turgor is also under 3 seconds. No lesions or ulcers, so the skin is intact. And it is warm to touch, so that is good. Thank you, Gabby. Now can I have your legs out for me? Yeah. Okay. Okay, legs are also within normal limits and symmetric. The hair is distributed evenly. The color of your skin matches your ethnicity. There's no edema down in your legs or ankles, and everything is intact with no lesions or ulcers. And then I'm just gonna do your feet. Feet are also match your ethnicity, and there's no lesions or ulcers or edema. And so I will check your pedal pulses, your dorsal, your posterior tibialis. Okay, I'll just check this one as well. Both pedal pulses are good and strong within normal limits. Alright, Gabby, we're going to start with some range of motion exercises. So can you just open and close your hands for me? Alright. Can you bend and flex your arms? Nice. Okay. And can you stand up for me real quick?
Mm-hmm.
Can you abduct your legs outward, away from your body, and then adduct them back in? Good. Okay, able to abduct and adduct. And can you dorsiflexion? So flex your, good, both of them. And then plantar flexion, so point downwards. Okay, you can have a seat back down. And then we're just gonna do some strength exercises. Can you squeeze both my fingers? Good. And then let's go here and pull up against my resistance and push down against my resistance. Same with this. Push up. Nice. Can you push up with both legs? Nice. Push up with this one against resistance still. And then we're gonna have you push downwards against my resistance. And up. Good. Keep your heel down, push down. And up. Okay. Nice strength. It is equal and symmetric on both sides of your bodies, and it is a rate of 5, and you have full range of motion, so it looks good. And last but not least, I'm just going to have a look at all your joints. Have you experienced any swelling recently?
No.
No, any pain?
Nope.
Okay, doesn't seem to have any swelling or pain or any deformities in the joints. Okay, looks good, Gabby. Well, is there anything else I can help you with today?
No.
No more questions?
Mm-mm.
All right, well, it was a pleasure being your nurse today. I hope you have a great rest of your day, and the doctor will be in with you shortly.
Okay, thank you.
Thank you.